And we're going to be discussing human rights, the decolonisation, the understanding and lack thereof, perhaps, of information in terms of SRHR, sexual reproductive health and rights. And I am joined this afternoon by experts in these fields. I feel that having spoken to some of them outside, there's a wealth of knowledge up here, and I'm incredibly excited to be able to hear and learn myself, but I absolutely want this to be an engaging session. So as we go, please maybe take note of any questions you have, even statements. I like to say that statements are great too. They're as good as questions, but definitely let's kind of engage. The only way forward for learning is to feel safe, be open-minded, and be confident enough to ask the questions. So let me introduce you to our panelists. So I will start from Fionnuala. So Fionnuala Murphy is here with us from Frontline AIDS. Fionnuala is head of global advocacy at Frontline AIDS, a global civil society partnership working together to achieve the global goal of ending AIDS. She's worked as a campaigner and advocate for 20 years, collaborating with partners from around the world to secure major wins in HIV financing, access to medicines, violence against women, and other areas. Fionnuala grew up in Northern Ireland, and she draws inspiration from her personal and family experiences in colonialism, conflict, and community resistance in her approach to advocacy today. Please welcome Fionnuala. Oh, you got a little woo! Come on! Thank you. Bonface Massah is our next panelist, and he comes to us with Standing Voice Malawi. He's traveled a long way, so we welcome you and thank you for making that trip. Bonface is the country manager for Standing Voice Malawi. Standing Voice is an international non-governmental organization based in Tunisia, Malawi, and in the UK that defends the rights of people with albinism. Bonface Massah is also a commissioner at the Malawi Human Rights Commission. His work has garnered international recognition, including his recent nomination by the government of Malawi as a candidate to join the United Nations Committee on the Rights of Persons with Disabilities. That's incredible. Put your hands together, please, for Bonface. Next is Salome, Dr. Salome Mbugua, Women's Aid and also CEO of AkiDwA. Dr. Salome is a researcher, gender equality activist, and human rights advocate. She's CEO of AkiDwA, the Human Rights Women's Network Ireland. She also serves as Human Rights Commissioner with the Irish Human Rights and Equality Commission. Her professional experience and expertise span over 20 years of work in civil society, focusing on underrepresented groups, particularly women, children, and youth in Europe and Africa. Put your hands together, please. Some seriously incredible resumes here. And then, of course, beside me then is Peggy Maguire, the European Institute of Women's Health. Peggy is a political scientist. She has worked at the international, regional, and national levels over the last 25 years, highlighting the need for gender equality and equity in biomedical research, public health, and social policy. Peggy is responsible for policy and strategy for the European Institute of Women's Health, and prior to her role as Director General at the EIWH, Peggy was the Director of Development at the National Maternity Hospital in Dublin, where I had all 3 of my children. Thank you for your service. Okay, let's kick it off. So, since I think you've traveled the farthest, I'm going to start with you, Bonface. So, as an advocate for people with albinism, can you share the specific human rights challenges faced by this community with a particular emphasis on accessing healthcare and the other essential services that go along with that?
No, thank you so much. Yes, I come from a background where 3 of us in our family, we are children of albinism. So let me start by sharing a story. When I was born, my mom told me that she was in a state of shock. She collapsed when she gave birth to me as the 3rd child with albinism. And when I started questioning her, now that I've grown up, to say, why did she collapse? She told me she felt the stigma, the rejection that was in the society. And right from the maternity ward to the community and back to raising 3 children with albinism, it wasn't easy for her. And I think this is a story when you look at people with albinism. We are born with a genetic condition that results into lack of melanin, affecting our skin, affecting our hair, but also low vision. And in contexts like Africa, it becomes so challenging for majority of us to be accepted. Just because we are a majority of black people in that population, and people with albinism, because of our white skin condition, we are now associated to be European. So the work that we do with Standing Voice is really focusing on addressing stigma around the persons with albinism, because across Africa, over 30 countries have reported human rights violation, kidnapping, abductions, and mutilations of persons with albinism because of misconceptions and beliefs. Apart from these physical killings and being hunted, we are now suffering from skin cancer as a result of the lack of melanin. And across sub-Saharan region, majority of us, we can't access to sunscreen. For European countries, maybe sunscreen may look as a luxury, but for us it's a product that I need to use every day for the rest of my life. And it's not even affordable and accessible. So the reality of us living in that context is that we need to keep on fighting right from birth to death. And this is why I think Standing Voice work has been so critical in focusing on access to health from a human rights angle. So we work with surgeons, health workers, providing knowledge and capacity building around the skin cancer. We also work closely with persons with albinism themselves to understand what albinism is, because there's also a lot of misinformation and disinformation around albinism. So our focus has been providing, running a skin cancer comprehension program across Malawi and even in Tanzania, reaching out to over now 11,000 persons with albinism in the 2 countries. And in Malawi, we are reaching out to about 3,000 persons with albinism. And we have worked closely with ESTHER Ireland. They have been supporting us. And also, we have Carol and Dr. Wheeler, a GP from Ireland, and Dr. Trish Ed, which we work closely. They always come out to support our surgical camp, but also ensure that we educate and build capacity of health workers to deal with issues of skin cancer amongst persons with albinism, which is also contributing a lot to us not enjoying our human rights, mainly when talking about access to health. Let me finish by saying there's an interesting aspect around this stigma and misconception when it comes to sexual reproductive health rights. We work in a psychosocial component as a human rights issue around albinism, and most women and young girls with albinism across Africa, including my country, Malawi, are now we call them single mothers now. They've been impregnated just because the society still believes that sleeping with a woman with albinism is a luxury. And then they'll sleep, they'll impregnate them, and then they'll abandon them. And now it's a very serious problem that we are facing in our program. How do we address this issue? Because it's also an issue of harmful practices, people believing that they can sleep with a woman, a young girl with albinism for their own negative and superstitious beliefs. Thank you.
Thank you, Bonface. That's some seriously powerful stuff. And I really felt, even speaking with you outside, I had no idea of these things, and to the severity, like you said, literally hunted. We chatted a bit about it outside that, I've said before that I'm sometimes, it feels like I'm too black to be white, but I'm too white to be black. That you could completely understand this, but in a different way. Can you explain to me as to where these this kind of stereotype of, the connection with people with albinism and death or danger or badness, where it stems from, and the kind of work that you've had to do to educate people from this mindset.
Yeah, I think if we look at the issues from a human rights angle, I'll start at how we framed our legal frameworks, the CRPD, the SDGs. If you look at those, elements of persons with albinism were already left out. So we are not, I think, focusing much on addressing the issues of people with albinism from a human rights angle. And then coming back to the basics, we haven't injected a lot of knowledge within our communities, within ourselves, for parents to accept persons with albinism, to raising a child with albinism. That has been a problem. So the lack of knowledge, as well as, and a combination of lack of available services. As I said, you go to the hospital, they'll just give you painkillers, yet you know it's cancer. You go another day, they'll push you away. You're in the maternity ward, this is your first pregnancy, and they'll tell you, what is this white thing? So you go through those cycles now and then, and as a result, you're always pushed away at different levels. So for us as Standing Voice, what we have been focusing much is, yes, let's target persons with albinism themselves to know, and even parents, but also let's work on the system. How do we strengthen the system so that the health workers should know that giving birth to a child with albinism is a genetic condition? How are we packaging our health education messages? So in all the clinics that we run, we start from there. Parents should know, health workers should know what albinism is. Clinically, we know it's a genetic condition, but outside there are misconceptions. As the writer said, are you black? Are you white enough? We all get all those questions. Growing up in primary school, people would come literally touched by skin. Is the blood red? So we go through all these processes, but for me, I think the critical point is let's focus on education. Let's have strategic measures like dealing with cancer, dealing with the actual killings. Let's also massively invest in uplifting and empowerment of persons with albinism, because I believe now growing up, having a good job, it has also elevated my status. I still get respect. I still get the bullying, but I can deal with the bullying. I still get the name calling, but I'm able to manage the name calling, which is powerful as a person with a disability. Thank you.
Thank you. And I just want to add, just you being even present in spaces, you're just an incredible advocate for people with albinism, and to show them that despite setbacks and difficulties that they can achieve anything, and there is a space for them, and that also your voice is as relevant and necessary as anyone else. It's a difficult thing because we're talking about human rights. Like Bonface is literally saying that, people with albinism are being denied the access to sun cream, a basic human right, something that we in the Western world would look as a luxury, but this is actually something due to a lack of melanin that will increase the chance of cancer within the skin. It's like oxygen, it's like being denied water, so you have taught me a lot, and I think in order to break down barriers and to hear each other, to hear and to truly listen, it's so important to be so open that way, and I thank you for that. Fionnuala, I'm going to come to you next. So as someone who has led global advocacy initiatives, what are some of the most significant policy barriers to achieving inclusive SRHR, and particularly in low socioeconomic areas and communities?
Thank you. Thank you, Emer, for this question. So I am going to talk a little bit about HIV prevention, which is one area of SRHR, and it's a really big focus for my organisation, Frontline AIDS. But first, I wanted to just say a couple of words about financial and economic policy. And I think one of the things that I want to really bring into the room is the fact that governments need to fund health systems and they need to invest in health services that are present in the places where poor and marginalised people live. And if they don't do that, then we can't have health and we can't have equitable access to health. And to be able to do that, they need to have progressive taxation systems so that they can mobilise funds for health. And they need to be free of things like economic conditionality, which might be imposed by bodies like the IMF, and they need to be free from catastrophic levels of debt interest that mean that they haven't got enough money to put into health and social services. And those things are bottom line, and they're also policy choices. They're policy choices that are made by governments and that are made by international actors as well. And in many cases, even if governments are able to do all of this, they still might not have the full resources that they need, and therefore they need international donor support to be able to build their health systems up. They need donors that will be there to address priorities in the here and now, as we needed in HIV at the height of the AIDS crisis, and that are also willing to invest in building sustainable health systems for the future. And it was so wonderful to hear the representative of Irish Aid repeatedly use the words global solidarity this morning, and also acknowledge that investments in health and health systems benefit everybody. It's not charity from one part of the world to another. It's ensuring that all of us are safe and that we have a safe health system as a global public good. Imagine a country where imagine a world where every rich country thought that way about global health. It's becoming harder to imagine that in the environment that we're living in after COVID vaccine apartheid and after one European country after another announcing plans to cut its aid budget, in some cases to cut it to zero. But that's the world that we need. Now I'll take us back to the question on HIV prevention in particular. And, you know, Mbugua spoke about this morning. We have incredible tools to prevent HIV. If anybody would like to hear more about them, come and find me. I'm not going to go through them all now. But despite the fact that we have these prolific tools which have been developed over the last 44 years, 1.3 million people contracted HIV last year, and that is an absolutely staggering number. And Mbugua also mentioned adolescent girls and young women and how vulnerable they can be to HIV in some settings. And I think, Mbugua, you shared the stat that 3,100 adolescent girls aged 15 to 24 will contract HIV in Africa every week. And just pause for a minute. It's really difficult when you hear stats, you go away and you won't remember them, but maybe you will remember that in the time that we spend on the panel, that's 18 girls that we're talking about. 18 girls that had the same hopes and dreams that any of us had when we were teenagers. And that vulnerability is underpinned by gender inequality, it's also driven by poverty, but again, policy choices are made that affect these girls' lives. And, you know, maybe a couple of things that I would talk about would be the fact that in a lot of countries, you simply can't access sexual and reproductive health services without your parents' consent if you're under 18. So you've got to go and tell your parents, who may be conservative, who may be religious, who may just really love you and feel very protective of you and not be ready to deal with that yet. And, you know, many of us have been there or will be there. You can't get a HIV test. You can't access even basics like condoms or family planning if you're a teenager without parental consent, and that is a real barrier. The same is true for access to sex education in schools, and I'll say a wee bit more about that. And from Mbugua, we also heard about criminalisation of communities that are most affected by HIV. Sometimes they're referred to as key populations. I'm not going to repeat what Mbugua said, but I want to say that criminalisation robs people of their rights, it robs them of their lives, and it prevents them from accessing health services. And there was such a moving line in Delroy's beautiful poem this morning where he said something about the fear that your family would find out and send you away. And that's what we're talking about, you know, the right to be loved by your own parents and your own family, and to be able to access health services that can keep you and others alive. Omanyana talked about the anti-gay law in Uganda, so I'm not going to go into that in too much detail. I think what I want to say about the examples that she shared is that these are not isolated examples. This is not a spontaneous uprising in one or two countries. We have an extremely well-funded, extremely well-organised anti-rights movement at work in countries and regions across the world. It is coming for HIV prevention basics. In countries where 1 in 10 or 1 in 20 people has HIV, this movement is campaigning to stop young people from getting condoms, to shut down comprehensive sexuality education in schools, to stop young people where they have access to services from getting it. So this is what we're dealing with. We're dealing with a highly organised movement that is trying to undo everything that we have worked for. And it does this by using highly emotive arguments, telling people that their children are in danger, that their children are going to be sexualized, prostituted, recruited into homosexuality. And, you know, we all know that these claims are false, but they're highly effective because they get right in there at the deep part of people's psyche around wanting to protect our children and our loved ones. I'm going to say just one final word and then stop talking, I promise, which is about colonial power and SRHR. And many years ago, I was working in an SRHR organisation in the UK, and there's somebody in the room who might remember this campaign we were running. It was a match funding campaign, so a big donor had given us a certain amount, and we had to fundraise the rest from the public. And somebody phoned us up and they said, I want to support your campaign. And it was a campaign, this was at the height of the AIDS epidemic, and it was all about, you know, helping people protect themselves. And they said, I want to support your campaign, but I'm not interested in all that AIDS and sexual and reproductive health. I just want to fund sterilizations. I just want black and brown people in the developing world to be sterilized. That's all I want to give my money to. And it was just so horrible to receive that phone call and to really hear the level of prejudice that was there. But on a lesser scale, or a less obvious scale, I have heard the same types of assertions from international donors. You know, I have seen in a donor strategy a statement along the lines of, you know, we think family planning should be the priority for reproductive health because that's a key way to end poverty. And of course, we all know that family planning's got a critical role to play in ending poverty, but it's not people's only reproductive health need. And I think that...
I'm going to come back to you because I do... No, don't say sorry. You're absolutely incredible and I want more. And I'm thinking of so many questions, as I'm sure many others are. I just want to get through, and we'll keep moving, but please, like, I have questions, I have comments, I have statements, I have so much I want to say. Like, I love that you shared data because data doesn't lie, guys, you know what I mean? If you weren't scared, now you should be scared because of everything you've just said, you know? And if you didn't care before, now you should. And we will come back. Thank you. No, we're coming right back. So, Dr. Salome, I would just like to talk to you maybe a little bit about your work with AkiDwA. I had the honor of being a part of a session where you launched a digital storytelling piece on FGM, female genital mutilation. It was so powerful. It's not something I had zero knowledge about, but I think you brought me to a whole nother place of understanding and actually how it affected me as an Irish citizen that I was unaware of. Can you talk to me a little bit about that, your work, and maybe give us a little bit of education?
Thank you so much. For those who don't know about AkiDwA, we are the network of migrant women living in Ireland, and we've been in existence in the last 23 years. So in those 23 years, we have brought new issues into Ireland, no longer the new Ireland, but the old Ireland now, after working here for 23 years. And so we are bringing the baggage of issues that the Ireland of 19th century or 20th century didn't have to deal with, and those are the issues of female genital mutilation. Female genital mutilation, it's a global phenomenon, so there's no country, I would say, that doesn't have maybe an experience of female genital mutilation due to the aspect of migration. And just to say that, we have over 200 million women and girls who have been subjected to female genital mutilation worldwide. In Ireland, we have 6,000. That is our estimate of AkiDwA for our 2017 prevalence, so it could be higher than that. But we've been trying to work hard and a lot about this issue. When we talk about issues of global health and issues of equity, equity, it's not just, we are not talking about equality here to be treated the same, just with like any other person. And those 6,000 women in Ireland who have been subjected to female genital mutilation to be treated just like any other women. We talk about issues of equity because, migration brings other issues like language barrier. We have issues of systemic barriers as well because, a woman who comes here as a migrant, her integration depends so much on her immigration status. And so if it's a woman who has female genital mutilation and she doesn't have a medical card, thanks be to God that we have medical cards for people who qualifies for those that they can access that support. But it has been a huge, huge challenge to support these women, sometimes in Ireland. Actually, this is one of the places here in the Royal College of Surgeons that we do deliver training on female genital mutilation. We've seen great awareness in recent time, but there's still a lot of work to be done to raise awareness and to support these 6,000 women. Actually, in the last 2 years, we have seen more women come from very high prevalence countries. And still so many people don't understand about the female genital mutilation. There's also the aspect of stigma. And there's also so many other issues that still affect women, especially who have health consequences. We only have one clinic in Ireland, the whole of Ireland, because resources is a huge problem. The Irish Family Planning Association, who are also partnering in this conference, host the clinic for female genital mutilation. But it's a real threat for women and girls. And if you're talking about partnership and supporting people, it's important that these women are supported in a meaningful way, but also the voices of those women and the people that works with them. For example, AkiDwA. We've seen quite often when policies are being developed or when strategies are being developed, whether it's on sexual and gender-based violence, sometimes, these issues are left out. And it's very, very important that, there's inclusion, it's included into this because it's a form of gender-based violence. And also including what we are actually dealing with more now in our organization of trying to enlighten people, so understanding of cultural, norms and attitudes and where people are coming from so that people can be supported more. So this is one of the areas that we work on. The other area actually, and I just finished, is on maternal health, because reproductive health is huge, in our work. And based on research that has been done before, 40%, of maternal death in Ireland in 2015 actually were from migrant women. That's a very high number. Again, women when they come here, they're able to access mainly maybe health. We've had in the workshops that I was in earlier, how it's difficult to access because we may have hospitals, we may have clinics, but the way women are able to access determines so much, on the approach that is presented when they actually present themselves at the reception, but also even when they meet the GP. We also have recently have big problem with lack of GPs. The women would stay for a long time without having access to GP. I think it's a national problem. It's not only for migrant women, but we have had that problem. But one of the key challenges that we have at the moment, it's access to counseling for women who want to access, who have gone through female genital mutilation. We totally don't have resources on this. We've seen an increase of awareness and willingness actually from many, many people here in Ireland wanting to understand, and in particular, really the Gardaí, the police here in Ireland, who are working with us on a campaign which is called the Limelight Campaign on Female Genital Mutilation. You might have actually seen on the TV, them working at the airport, raising awareness of children being taken out of the country for the purpose of female genital mutilation. But what I want to say is that female genital mutilation is a real huge problem and a threat to many women here in Ireland and around the world. And if we can open ourselves to learn more and to support, would be very good.
Thank you. Just on that quickly, if I could, because you've mentioned, your work with the Gardaí and you work with many policymakers. One common theme I'm seeing is that when we think things don't affect us or it has nothing to do with us, in fact, we couldn't be more wrong at how much so we are impacted by these things, unbeknownst to ourselves at many times. But can you just give us an example how you have been able to engage with policymakers to help them to make those changes? How do you reach people to make the changes that are necessary?
It's really funny because, I'm from Kenya originally, and in Kenya as well, it's whom you know. In Ireland as well, it's so much depend on whom you know. So myself, I've been put into contact with so many people, including Peggy here, to people who can help, even to start the network. The network of migrant women is purely led by migrant women, which we founded in 2003. Sometimes it's very, very difficult even to make a move because we don't have those connections, or sometimes, we feel that you're not listened more or, believed, when you talk about being believed and all that. But believe me or not, we have been able to play magic in those last 23 years. And this is because of the people that have, connection of connections, who have helped us to get funding to do the work we do, but also to be able to reach those policymakers who does the real deal. And this is actually with our female genital mutilation of 2012, where we worked with some of the policymakers to come with the law in Ireland of ensuring that, children are not taken out of the country. So we have a law, the female genital mutilation 2012, that it has an extraterritorial element, that you cannot take the child out of the country. Our film that you saw and the work with the Gardaí is actually reinforcing more on that the children are not taken out of the country for that. But apart from that, we are working with the GPs now. We have seen maternity hospital opening. They have actually been able to add FGM in the maternity record form. So when the woman goes to the maternity, so those are some of the policy areas. And as well, many other areas that we are still working on to ensure that the FGM is part of the curriculum of nurses, or people who are training to work in hospitals and clinics. So we can say we have achieved as a migrant woman, bringing our voice. Again, sometimes it's so because we don't have that pure connection, but we do get people who connect us, or we do go even into the door, like into the Irish Parliament, and meet some of these TDs who would listen to us, and some of the people who are actually very much into policy making. So it's good. And our president, for example, understands issues of human rights and issues like we are talking about of development and globalization. So we have received also support from very high level to the very bottom level. So it starts with understanding.
Thank you. I also am seeing a common theme again is having those diverse voices at the table, having people from these communities part of the decision making. And Peggy, obviously with the National Maternity Hospital, I'm sure a lot of what Dr. Salome is saying is not news to you. But can you speak a little bit on the importance of that diverse voice and presence being reflected, and how that helps and change, and how important, and actually how it's holding us back a lot of the time, not incorporating that kind of equity piece?
Yeah, absolutely, and I agree with everything that's been said already. I think, women have been held back for a number of years. There's been such a politicization of women's rights, and particularly women's sexual and reproductive health rights, particularly in the current situation where you have populism and the right wing. And so therefore, in these situations, I think you have an erosion of more of an erosion of women's rights and sexual and reproductive health rights. And it doesn't happen. This is happening globally, as Salome said, with FGM. It's also happening in Europe as well. And that's the pity of it all, because you have loads of countries in Europe that have right-wing governments, and I just mentioned one in particular, which is Hungary. And at times like this, if you're promoting gender values, equality and human rights, you're seen as a threat to the institutions. That's a huge, huge issue. I think the Institute came about, the organisation I work for, came about because there wasn't a voice for women and women's health in particular at an EU level. And this was one of the reasons that the Institute was set up. And as Salome said, we you have to work with policymakers, you've got to influence them, and you have to use an evidence-based approach as well to influence the policy environment. And what we've tried to do in producing this evidence-based to show that we're not a homogenous group as women, there are diversity, but you have to look at intersectionality, and that where you live, who you are, what you earn, and from what ethnic background you come from, all influences your health. And apart from those social impact, you also have the biological impact as well, in the fact that women haven't been included in clinical trials for testing of drugs for a number of years. And it wasn't until 2014 when the clinical trials regulation at a European level was revised. We tabled amendments in the European Parliament to make sure that gender and age, and also pregnant women, there was a special section on pregnant women, was included in the clinical trials regulation. So it's important that our voice was heard, and we tried to make sure that we included and collaborated with different organisations that included a diverse voice as well. And just before the EU elections this year, we produced a manifesto highlighting the issues around women's health, looking at the fact, basically giving the facts and figures as to why women needed to be heard, and a specific issue around, a specific focus on women's health was needed at an EU level. And we have 34 organisations that we're working with, and we're aiming for 50, but there's a cross-sectional there, women's NGOs, health NGOs, academia, and also healthcare professional organisations as well, because I think you need to work together. I think if you want to affect any kind of change in society, you have to have a collaborative approach, and to make sure that you have a critical mass of people who are willing to influence the policy environment. So what we're calling for at a European level is an EU strategy for women's health. But listening to our other panellists here, you think we need a global strategy for women's health. We need to work together on that, because really everything is geopolitical now. Health is influenced by geopolitics, so we really need to work with other organisations as well. But we need to make sure that we listen to the voice of women, because rights are being eroded, and particularly in times of war and crises. As Salome said, when you have migrants whose health becomes at risk because they are stateless, homeless, and they are at risk of gender-based violence as well. So that really needs to be looked at. And I think what Fionnuala said as well about the economics and the investment, I think in our manifesto we kind of demonstrate as well that by 2050 the GDP in the EU would increase by 2 to 3 trillion if gender equality is improved. Gender policies have been shown to have a stronger impact on GDP growth than labour market and educational policies. So health inequalities result in an economic loss of about 980 billion per year in the EU. So an investment in women, across the board, all women, not just academics, etc. We need a diverse voice being heard, and we need to make sure that there's an investment of women's health across the board, and to make sure that the priorities are what the women need from a community level. And I think we can learn enough from global health. I think an awful lot can be learned from global health and what's happening in third countries, because I think we have become complacent in the developed world. I think that I'll leave it there at the moment. I hope I've answered your question.
Yeah, thank you. I keep thinking of, sustainability and the Sustainable Development Goals, and this kind of, it's the buzzword now at the moment, and companies are getting on board. They want to be sustainable. They're thinking of global citizenship and cultural awareness and all of this. Sometimes what is the missing part there, though, that I think we don't see in terms of the Sustainable Development Goals, is the equity, the equality, the diversity, the inclusion, is the person, the human at the centre and core root of all of this. And I think all of you and how you've spoken has really kind of emphasised how we as humans play a part in this, and how the state of the world, being it that it's dying itself, is also a reflection of us as humans, humanity, and that fact that we can tend to live in a bubble, that if it's happening over there, it doesn't affect me. But through everything that you have all said, it keeps coming back to all of these things affect us. They all affect us. And the more we kind of open our minds and accept and acknowledge the changes that are necessary, I think the better for us as humans. But I really think I'd love to kind of open up the floor. I know I have a lot of questions, but is there anybody, based on all of our speakers so far, that has either a question or even just a statement as to maybe how they've been impacted by some of this, what you might have learned, or what you still would like to know? No? Okay, I'll let you simmer with that for a moment, and I'll say one. Just wondering myself, I think threat has come up, and threat for me it seems to be a common theme again. We're talking about common themes. But where is it that people and civilization can let go of ownership of things and not feel threatened by change? And it's to all of you, but maybe Fionnuala, you might speak to this, just even in terms of what we see with far-right agitation and the concept of not just accepting difference and understanding intercultural awareness, but being okay to not feel threatened and to allow others a seat at a table without feeling threatened by their presence or that they're going to be taking something from you.
Let me see what I can say in response to that. I mean, I think that maybe just to bring us back to this panel for a minute, you know, you bring a group of people together and then immediately you start to hear about so many different facets of people's sexual and reproductive lives that matter to them profoundly in those moments, you know, whether that's that young girl that could be protected from FGM, whether it's a woman who's going in to give birth and she's been through FGM and she has the right to, you know, really sensitive care, whether that's that pregnant girl who maybe, if she'd had the right protection, would never have had to get pregnant in the first place with albinism. And, you know, it's such a reminder of how what we need to do when it comes to sexual and reproductive health and rights, but I think in all areas of our work, is listen to communities and be with communities and elevate their priorities and don't try to co-opt them into delivering on our priorities. And I think that is an important start for any area of work, but I think it has resonance to the anti-rights piece as well, where ultimately, you know, people who have got on that particular bandwagon, many of them are not convertible, and I don't think we should waste our time trying to change their minds, but there's a job to do around minimising the damage that they can do, both the damage at the individual level in terms of who else they can bring on board, and then the damage at the policy level. And I think at the individual level, and this really brings me back to my experience of the conference that the network hosted a year ago, which was a very different format. It was all about storytelling. Anti-rights activity has its most profound impacts in people's hearts and minds, and then in the lived experiences that they then inflict on others. And I keep just coming back to Delroy and that line of his poem. And people will not change their minds based on factual arguments. People will change their minds based on what is felt and on real stories and lived experiences and that moment of connection and common ground. And one of the most powerful things that I've heard said about the anti-gay law in Uganda, for example, was my boss, who's from Zimbabwe, who has a gay son, and she wrote something on her LinkedIn when the bill was approved, and it was just, you know, she was just reflecting on, as an African mother of a gay child, what it felt like for her to see that happen, and it was so moving and profound. And I said to her, I wish that you had have published that a few months ago and put it in the media in Uganda. It was so strong. So I think that's important. And to avoid hogging the mic again, this is the last thing I'm going to say. I think that the resistance to anti-rights actors and all far-right actors is going to be strongest led by people who are on the front line of anti-rights attacks, and especially when those movements are united. So women's movements, youth movements, LGBTQ+ movements, anti-racist movements, you know, the human rights movement, pro-democracy, those movements need to be well-resourced, well-organised, well-coordinated and working together. And we need international donors who care about human rights to put money into that, because a lot of them are very worried about it, but there's no money to do any work, and we need that. Thanks.
Thank you. Absolutely not hogging the mic whatsoever. Thank you for your very valid input. Before I go back on stage, you've got something. Thank you.
Yeah, thank you, Ian from Mission Cara. Just on the last thing on Uganda there, the rights and your point about an anti-rights movement, which I think is interesting. So I was in Uganda not that long ago, so there people were saying, commentators were saying that a lot of the anti-homosexuality bill that became a law that was then negated after was coming from fundamentalist churches from America who were trying to drive that. So I suppose I'm asking you, what are the drivers of that anti-rights? That maybe is one, maybe that's not one, but that's maybe one, and what are the other ones? Maybe. Thank you.
Thank you for your question. Yeah, Dr. Salome. Good.
I wanted to mention about, the far right, but also, because we are talking about decolonization as well, in terms of, when we look at it into the lenses of when we talk about health. But I think we also all need to decolonize our mentality of how we see each other and how we perceive each other, because there's been a lot of misinformation, and that misinformation continues, which is affecting people. Our organization was very much affected by far right. We received a lot of calls, threats, and everything. We had to engage with Gadi, and Gadi coming into our office as well because of that hate. But what people lack to understand, especially, for example, let me give an example with Ireland, is that most of our people, especially the women that we work with, migrant women, are concentrated into care. They are providing very essential services into this country, and they need to be protected. Not only protected, but from a human right perspective, which has to be upheld, they have to be treated with dignity and respect for what they are providing. But they are also, paying tax and improving the economy of a country like Ireland. We really need to look at people like, it's not when we used to talk about Africans who are very, very far away from us and giving the penny to the child out there, but people who are here, who are equally knowledgeable, and that knowledge should be tapped into, and used into better use of advancing a place like Ireland. So we have a huge role to play to educate people and to enlighten them of the role that migrants, for example, are playing here and everybody else is doing. If we are actually going to keep into the theme of this conference, which is to better our planet, it's actually understanding that we may be different in the way we come, but we are all equal. And, Mandela said it all, people are not born with hate. They learn to hate. And if they learn, they can also learn, if they learn to hate, they can also learn how to love. So I think with the far right, they are misinformed. And it's important because, most of you, maybe all of you in this room, would be very much against what the far right are doing, especially when they go to ban places where people are living and what is happening. Not understanding actually most of those people, even those who are living in accommodation centers now, do go to work and support, Ireland in so many different ways. So I really wanted to say that from that perspective, that we really have to respect people and treat them with the dignity and respect, and standing into this and really like wanting others to have what you would want yourself, rather than seeing them as outsiders or they should not be here because, we have so many judgment upon them of what you have heard about where they are coming from. So we are still faced by the threat of far right, but I think we can all stand up and resist that and, not in our name.
We are stronger together. Yeah, stronger with unity.